Hi, my name is Shasta Abrahams with the Los Angeles Pacific University and the Master's in Public Administration program. Today I'll be talking about my capstone project with mental health disparities among Black Indigenous people of color. Why is this an urgency? Mental health is a pressing global issue that can have devastating consequences when individuals suffering from mental illnesses do not receive the necessary assistance that they need. It is heartbreaking when our friends pass away due to hidden struggles, and we're not often unaware of their difficulties, and it's too late for us to get them help. Sometimes they're crying out for help, and we're not able to assess them and see what actually services they need. Mental health related mortality rates have increased since 2020. The suicide rate in the United States has increased by 33% in Black people since 1999. For Alaskan Native women and men collectively, we have seen a 71% increase in suicide rates. For the American Indian women and men collectively, we have seen a 139 increase in suicide rates. Suicide rate at the third leading cause of death among Black youth and children of color since 2020. Our community issues and needs for mental health issues are prevalent across all communities and social classes nationwide. Institutionalized racism plays a part, as well as lack of services significantly impact the mental health of individuals and Black, Indigenous people of color. These communities have marginalized communities face challenges in obtaining health insurance coverage and assessing mental health services. There's a cultural stigma, discourages individuals from seeking assistance. Black and Indigenous people of color individuals often experience environmental stressors leading to psychological stress, depression, and a higher likelihood of sharing suicidal thoughts. There are organizations out there called the Anxiety Depression of Association of America, and their organization is there to help um, assess people of color that are going through depression. They focus on supporting individuals in managing anxiety and depression. They provide mental health services to all individuals with focus on Black Indigenous people of color in their communities. They gather personalized data better to understand the culture's unique needs and treatment modalities. With this information, they collaboratively partner with other organizations nationwide to help the diverse and individual diversity and innovative teams and with professionals to help with their treatment modalities and help with educational resources and current and accurate data. They prioritize serving people while embracing diversity and inclusiveness as a fundamental values. They aim to positively impact people's lives using science, technology, and innovative treatment modalities. The ADDA's communication plan, they actually they're an organization they recognize the negative effects of racial and injustices and societal disparities among the Black Indigenous people of color in their community. So they have a diverse professional network and global influence. They hire people specifically based on competent skills to deal with people of color. They use internet connection to reach out to the global audience and provide valuable resources through websites and affiliated links. They provide sources to the clinics to schools, to businesses, for resources for the Black Indigenous people of color. What are the stakeholders' needs and interests? They foster collaborative efforts to raise awareness and inequities in mental health care for Black Indigenous people of color, and they address cultural stigmatizations surrounding the mental health. They mitigate underdiagnosis and misdiagnosis of mental illnesses among racial and ethnically diverse populations. They focus on both local and national levels of advocacy. What is the proposed solution and communication plan? The current plan at the state level and local levels, they communicate by surveys, client interviews, town hall meetings, public awareness, advertisement, annual physical assessments, community forums, social media, and emails. Communities should prioritize mental health awareness. July is actually the month that they've chose for mental health awareness among minorities. So collaboratively, they network, and the physicians and the therapists usually get together to bring forth services and have open discussions about mental health to people of color. They offer free clinics and free services, encouraging people to seek medical professional help when they're essential. The employers, they communicate during their annual physicals and let the employees know that they care about their mental health wellness. What's the rational base of theory, research, and evidence for why this solution is an improvement? The ADAA organization has assisted over 15 million individuals from diverse age groups to ethnic backgrounds. They use evidence-based scientific research and tools to gather information and resources from specific nationalities. They also personalize data collected help to understand each culture's unique needs, interests, and treatment modalities. The ADAA collaborates with partner organizations worldwide to cultivate a diverse and innovative team of professionals. Through research, including peer reviews, clinical trials, and testing protocols, it's part of their program's plan and their communication. The ADAA organization has assisted over 15 million individuals from diverse age groups and ethnic backgrounds. They have evidence-based scientific research and tools to gather information and resources from specific nationalities. What is their communication plan? The organization recognizes the negative effects of racial injustices and societal disparities among the Black indigenous people of color in their communities. So they work with professional network and have a global influence through internet and communication through social media. What's the implementation plan and a timeline? With collaborative efforts with multiple partners and community involvement, the need is addressed to address the challenges associated with the disparities among the Black and Indigenous people of color. They actively listen and genuinely understand the stories and concerns of individuals in the environment. And they understand the experiences of marginalized communities, especially people of color. With this, they're giving a 1 to 3 year timeline to allow the budget and finance to allocate funds towards a pilot project and training skills, training for competent skills of employees. With evaluation and metric success, ADAA uses social media platforms, webinars, blog posts, and community outreach programs to communicate to stakeholders and subscribers and take surveys. Statistics show that Black and Indigenous people of color individuals face elevated environmental stressors, psychological distress, depression, and suicidal thoughts. Targeted these groups with resources and measures. We measure the success and the success rates. But the plan is to aim and address disparities in BIPOC people and their mental health outcomes by using updated data and observing treatment trends, analyzing trends during and after the plan is implemented. The plan will continue to spread globally and bring in some more supportive resources annually, measuring the impacts of all the stakeholders. We can measure the success of our plan based on the information gathered and determine if it significantly reduces the barriers to mental health disparities in the BIPOC communities. In conclusion, communities must prioritize mental health awareness and open discussions about the topic, creating an environment that encourages individuals with mental health challenges to seek professional help, ensuring fair and excellent treatment for everyone and unrestricted access to mental health services, providing services that cater to the unique needs of the BIPOC individuals. Thank you, and that would be in my conclusion.